Hi, Dr. Yass here. I want to talk about the issue that probably confounds me most of all about the way the medical establishment addresses how to treat chronic pain, and that is this idea of surgery as a last resort. I really don't have any understanding of what that even means, and if you're looking at it from the outside, to me, it would seem that surgery as a last resort is an indication of the lack of belief by the medical establishment that surgery is the key to resolving your symptoms. I think most people would recognize that if you truly believed that this mechanism was the answer to resolving someone's pain, wouldn't that be the first thing that you would want to recommend? Not the last thing? Isn't by nature the fact that it's this weird default an indication that even the medical establishment themselves doesn't believe that the structural variations being identified on MRIs, which ultimately are what they are promoting as the cause of your symptoms and therefore require surgical intervention? Isn't the fact that they say, let's try everything else other than surgery, an indication that they don't think surgery is the appropriate approach and that it's simply done by default? And certainly, I know massive numbers of the people that I have treated after failed surgeries told me that the practitioner said to them, "You'll tell me when you need surgery." The medical practitioner is not saying, I, as this educated and trained practitioner, can tell you exactly why you need the surgery and when you need the surgery. It's just the opposite. They are telling the individual, when the pain gets too bad, just tell me and I'll be happy to do the surgery for you. I really think you need to see this premise from the outside. Forget what the medical establishment practitioners are telling you. Try to see it from a logical standpoint. An MRI finds a structural variation, a herniated disc, stenosis, a pinched nerve, a meniscal tear, a compression fracture, spondylolisthesis, shifting of the vertebrae front to back. All these types of structural variations. They tell you that's the cause of your symptoms. It would certainly seem logical that as a practitioner, I'd like to see my patient out of pain in the shortest period of time. So why wouldn't I be saying to you, I am confident that that structural variation identified is the cause of your symptoms, and therefore, if I correct the structural variation, you will not have pain. Let's do it tomorrow. Why not? The answer is obvious. The failure rate for surgery, especially back surgery, is massive. The majority are failures. Roughly 70 to 80% of back surgeries are failures. We can look at the joint replacement thing, which became the massive hot button surgery to perform. Oh, everybody's bone on bone. It's incredible. In the last 10 years, it appears every person on the planet is bone on bone at the knee or the hip. And yet, somehow, before the diagnosis could have been created, prior to that, nobody was bone on bone, I guess, because no one was getting those surgeries. I mean, you have to appreciate the idea that it seems that only because joint replacement is so much easier now that everybody seems to need it. But prior to that, nobody needed it. Somehow, the degenerative process, which leads people to that false diagnosis of bone on bone, has developed in the last 10 years. The hundreds of thousands of years prior of man living and walking on the earth, I guess they weren't bone on bone. I mean, the whole idea of everybody requiring these surgeries now is just insane. That alone. But the fact that after the surgery, the person still has the symptoms, oftentimes groin pain, which is actually more indicative of a strained muscle in the groin region, and that could be proven through the use of the Yass method, which I would highly suggest you utilize before getting the unnecessary surgery. But you end up still with that symptom, and you're told, oh, the prosthetic didn't take properly, it's not fit properly, the prosthetic broke, and therefore you need a revision. The newest hot button surgery. Everybody I'm treating after the fact is telling me that not only did they get the initial joint replacement, but shortly thereafter, they got a revision or 2 or 3. You just have to appreciate that these surgeries are illogical. They just don't make sense. And my opinion is that medical practitioners recognize this. The evidence is overwhelming. From a theoretical perspective of the MRI being completely invalid to the failure rates of these surgeries, don't forget, it was the medical establishment who felt compelled to create the diagnosis of failed back surgery syndrome. Failed back surgery syndrome. Think about that in your head. This diagnosis didn't exist until all these surgeries were being performed, and people are still having the same, if not greater, pain, and therefore, we had to account for it somehow. We need a diagnosis that we can continue to provide treatment, including extra surgeries. So we'll just create the diagnosis. Failed back surgery syndrome. Again, the medical establishment who is recommending surgeries as a last resort, which in itself makes no sense whatsoever, creates a diagnosis called failed back surgery syndrome. This should shock you and scare you beyond belief. It should make you say that if there was an alternative to the existing system, I would certainly want to go in that direction before considering following through in any aspect of the way the existing model works, and that is the Yass method. Just think about this. Let's say they're right. Let's just say they're right. A herniated disc or stenosis, some kind of pinched nerve, whatever. A structural variation is the cause of your symptom. And you're told surgery as a last resort. Let's try everything else. A herniated disc supposedly is where this disc has shifted and it's eliciting pain, which is a fallacy because disc material is made of fibrocartilage and fibrocartilage has no pain receptors in there, so disc material could never cause it anyway. If it was to pinch on a nerve root, and we need to differentiate nerves from nerve roots, nerves do not attach to your spine, so that's it. Anyone telling you you have a pinched nerve is just again, it's a meaningless, illogical, irrational statement. Nerves don't attach. Nerves don't come off the spinal cord. Nerve roots come off the spinal cord. Nerve roots can be impinged by a herniated disc. So if you had an impinged nerve root, it would create a symptom only in the area of skin that's innervated by that nerve root. They're called dermatomes. You could see exactly where they are. Anybody could look it up and see what a dermatomal chart looks like and which nerve roots invade certain areas of skin, and you would see that your symptom has nothing to do with that area, again, showing that's invalid. But let's just say, for instance, that that was the cause. In 2 to 3% of the population it is. The other 95 to 98% it's not, it's muscular. But let's say you happen to be one of those. What would getting physical therapy, chiropractor, acupuncture, epidural nerve blocks, any of these things do to alter that structural variation? Nothing. And if that's the case, isn't surgery really a self-fulfilling prophecy anyway? isn't the idea of it being the last resort really the only resort? And so therefore, this notion that you've tried everything and nothing else has worked and therefore you need to get surgery is really kind of a foolish statement. Because the fact was none of that was going to work if in fact the cause was structural. Only surgery would alter a structure. So by nature, this idea of surgery being a last resort is really not true. It's really the only resort, and everything else is basically just a mechanism to make you feel that you've tried everything else, and therefore when surgery doesn't work, you could say, and the surgeon can say, well, listen, it was your last option. You didn't really have any other choices. That is crazy. But that's the system. That's what you live in. Unless you're willing to step outside of this system. That's the Yass method. The Yass method is designed to interpret the body's presentation of symptoms, to identify what tissue is in distress, which is leading to the presentation of those symptoms, which is exactly the way the body works. No one's confused about the fact that if you have pain at your chest and your left arm, that particular symptom is representative of distress of the heart muscle. And therefore, when you're having that symptom, you immediately seek medical attention to address not the pain, but the distress of the tissue, which is the heart. Same thing works for the neck, the back, or the extremities. The body is presenting very specific symptoms. A great diagnostician is a great interpreter. He's able, or she is able, to interpret the presentation of the symptoms to understand what tissue is eliciting those symptoms. Once the proper tissue is identified, distress of that tissue is resolved, thereby ending the need for the body to release this emergency protective mechanism of eliciting pain, and your pain stops, or your altered sensation stops. That's the way it works. That's how the body has always worked. This has been basically confused by the use of the MRI, which finds structural variations, which in 95 to 98% of cases has nothing to do with the pain tissue eliciting the symptom. The tissue eliciting the symptom in 95 to 98% of cases is muscle. It's muscle. It's been proven. All the evidence shows it, theoretically, clinically, scientifically. There's actually a theoretical basis, part of the Yass method, which is to say that you live in a gravity environment, you're trying to create functional activities. If the muscles aren't strong enough and don't have enough force output equal to the force requirement of the activities you're performing, they're going to strain and elicit pain. They might strain and refer symptoms through trigger points in the muscle. So you could have a rotator cuff strain causing altered sensation in your hand. That altered sensation in your hand will only be diagnosed as a cervical nerve root type of cause through the medical establishment because that's all they know. So you could even have a muscle impinge on a nerve root, which is exactly what sciatica is. That has nothing to do with the lumbar spine. So that's the reality of it. So my opinion is, if I was you, I would never accept this idea of surgery as a last resort. It's a meaningless statement anyway, and any system that would promote that is a system I wouldn't trust. I suggest you seek the Yass method so you can get a proper diagnosis in the way that the body wants you to, which is through the interpretation of symptoms. If you want to get more information about the Yass method, you can go to my website, www.mitchellyass.com. You can contact me through my email address, drmitch@mitchellyAss.com. That's drmitch@mitchellyass.com. Call me by my cell phone, 516-449-1359. Doesn't matter how you get the method, just get the method. This is your chance to end your pain. If you have acute pain, we could resolve the cause and prevent it from becoming chronic pain. If you have chronic pain, this is your chance to end the system and end this cycle of continuous pain. You can resolve your symptoms, you can regain your functional capacity, and reclaim your life through the Yass method. For now, this is Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Bye-bye.